From September 20th, when the Ministry of Health announced an Ebola outbreak in the country, a total of 141 infections have been recorded with 55 fatalities. Although the outbreak is gradually being contained with fewer infections, the Ministry of Health says they will go on the commencement of vaccination trials of the Sudan Ebola strain.
Currently, in our fight against Ebola in the nation, we have 55 people who have passed away. We have still 141 cases and about 70 recoveries. In the last 15 days, we have no new case, and in the last 15 days, we have had no loss of life.
Ministry of Health has confirmed the arrival of 2 trial vaccines in the country, and hopefully the vaccination exercise will begin in a space of 2 days.
A trial for the Ebola vaccines process is starting this week, or has already started. A study does not start by the day they vaccinate the first person, but all the preparatory phases are all complete.
Dr. Kyabayinze says the vaccination targets about 300 people who are mostly contacts of Ebola patients.
So the people have already been trained to give Ebola vaccine. The team is assembled, the protocols are approved, and so they will start ring. They are going to do what they call ring vaccination. They start by an infected person and they vaccinate all the people around, level 1 contacts and level 2. But to give them vaccination and the health workers as potential people to see how we protect. These studies need to be expedited, but we thank God even the numbers are coming down.
These will be inoculated with either of the 2 candidate vaccines that have been imported.
We have 2 vaccines, one from Oxford and the UK, and then we have another vaccine from the US Sabin Institute. So those are the 2 candidate vaccines we are likely to be working on. There was also a 3rd one, but I think the priority will be for the first 2.
The Ebola virus circulating in the country is the Sudan strain, which has no proven vaccine or cure, unlike the more common Zaire strain plaguing neighboring DRC. Dr. Kyabayinze, however, reveals that the continuous lockdown in Mubende and Kasanda has greatly helped to curb the spread of the Ebola virus.
So the impact of having localized lockdown has given us yield, and we think this is the best approach to manage outbreaks when people do not follow all the regulations.
Over the weekend, President Museveni, through his vice president, extended the lockdown in the 2 districts of Mubende and Kasanda on account that the situation